Okay, so I'm just gonna show you the room. Okay. Okay, so I will begin by verifying the medical orders for insertion and gathering my necessary equipment. I will then perform hand hygiene and put on appropriate PPE. I will then introduce myself to the patient and identify the patient. So, hello, Mr. P. My name is Erin Garza. I will be your student nurse for the day. Can I please have your full name and date of birth? Okay, once I give it and it all matches, I will then explain the procedure to the patient. So, Mr. P, as per your physician orders, we will be inserting an NG tube. This will help you with your feedings and oral medications because you're having difficulty swallowing. So then I will be assembling equipment on the overhead table and putting it within reach. I will then provide privacy by closing the curtains, and if there's a door, close the door. I will then measure the distance to insert the tube by placing the tip of the tube at the tip of the nose, and then to the tip of the ear, and then to the on top of the xiphoid process. I will then ensure to lubricate the tube at least 2 to 4 inches. Once I have done that, then I will ask the patient to occlude each nostril. So he's going to occlude one, breathe in and breathe out, and then do the other one, and breathe in and breathe out. And I will find the most patent one. That's the one that we will be inserting the tube through. I would ask the patient to flex their head back against the pillow and then gently insert the tube into the nostril that we have chosen in the up and then backward position through the floor of the nose. And then once it touches the pharynx, I would ask the patient to touch the chin to the chest and encourage them to, like, if they're NPO, to take a sip of water, and if they're NPO, to swallow saliva. If they're regular, then we can ask them to take a sip of water. If for any reason the patient begins to gag or coughs, I would stop the procedure and ask the patient to open their mouth so I can, with the tongue blade, check their throat and the flashlight. With the flashlight, I would discontinue if there was any gagging or coughing or gasping. This would stop the procedure completely. Once I have ensured that the NG tube is positioned correctly, I would temporarily secure it, like with tape on the cheek or on the nose, so I can ensure that it's in the stomach correctly. I would attach a large syringe with a plunger to the to aspirate, like we would have it here. We'd aspirate to see the stomach content, and then we would measure the pH of the stomach content, making sure that it is below 5.5. This would give us an acidic. I would then visualize the aspirated content by checking the color and consistency of everything. I would also obtain an X-ray, which is the most reliable form of determining the position. After I have ensured the proper placement of the tube, I will secure the tape. I would secure the tape by making sure to cut a 4-inch tape, and then the bottom 2 inches I would slice it in half, and then I would place the full tape on the tip of the nose, the bridge of the nose, sorry. And then on the NG tube, I would wrap the splitted 2 inches around the NG tube to secure it, making sure not to tighten it too much against the nose. I would then clamp and remove the syringe and cap the tube and attach it to the suction if suction was applicable. Once the tube is capped, I would measure the excess tubing that is left and document it. I would then ask the patient to turn to the opposite side. So let's say we put the tubing on the right side. I would ask the patient to turn to the left side and then secure it with the tubing with the pin to ensure it doesn't move. After tubing has been secured, I would go ahead and then provide oral hygiene every 2 to 4 hours in 2 to 4 hour intervals, and lubricate the patient's lips as necessary. And then I would remove the equipment and return patient to a comfortable position and document everything. Once I have administered the tube, now I would be administering the actual feeding. So I would begin by gathering my necessary equipment and positioning the patient's head of the bed elevated to 30 to 45 degrees, or like a normal eating position of the patient. So once I have done that, I would then unpin the where I had pinned it on the opposite side of the patient's gown, and verify the position of the tubing. So I would measure the length that is exposed and compare it to the documented amount. I would then attach the syringe with the plunger, and at the end of the tubing, so I would attach it with the plunger and aspirate determine the residual. Once I determine the residual, it cannot exceed from 200 to 250 mLs, because other than that, then that would be a concern and we would have to call the provider. Once I have removed the residual volume, I would check the color and consistency. And then for any reason, like if it cannot be aspirated, or the length of the exposed tubing is different from the one that was documented, I would have to check the placement of the tubing with an X-ray. If the amount is the residual amount is within normal, it has not exceeded 250 mLs, then I would flush the tube with 30 mLs of water, and then clamp and disconnect the syringe from the tubing, and then I would cap the end of the tubing and prepare the formula feeding if it is not prepared, and then I would administer the feeding. For a open system, I would begin by removing the plunger of the 60 ml syringe and attaching the syringe to the actual feeding tube, and then pour the measured amount that is required. If I want the feeding to go in faster, I would pick it up higher. If I want it to go slower, I would put it down lower. I would make sure not to push the formula in the syringe with the plunger. I just keep it on the side. And then once the formula has gone all the way through, I would add 30 to 60 mLs of water into the syringe to irrigate the feeding tube. Once the irrigation is done, I would then hold the syringe high and clamp it and disconnect the tubing. So I would then observe the patient. I would observe his response. I would check assess his abdomen at least once per shift to make sure everything is within normal ranges. I will have the patient, once I've administered the feeding, I would have the patient remain in an upright position, whether it be in the high Fowler's position or in the sitting position, 30 to 45 degree angle for at least 1 hour. After the feeding has been done. After the 1 hour has passed and the feeding has been done, I would return and put the patient back in a comfortable position. So if we were to be administering medication, I would perform perform hand hygiene. I would go to the MAR and perform my first check by checking the MAR and comparing the MAR and selecting the proper medications. And then once I have selected the proper medications, I would then do the second check, would be actually selecting the medication and taking it out of the dispenser and comparing the medication to the MAR. Checking if I have to do any calculations, I would do it at that time, or if it is expired, checking the expiration date. Okay, after that, I would begin by preparing the medications. So in this case, we do have to prepare 2 medications. So for lisinopril, I would use a pill crusher. I would crush the pill if appropriate, and making it into a dissolved powder, and then I would put it in 10 ml of water. Once I have done that, I would prepare guaifenesin, which is a liquid form of medication, and that one we would pour it into the medication cup. That's all we would have to do, from a multi-dose vial to a medication cup. I would then perform the third check here by making sure that I have the appropriate medications, that I have done the third check, that I compared it to the MARA, that I have the actual medication, it's not expired or anything. And then a third check, I would do it also at the bedside of the patient. So once I'm at the bedside of the patient, I would perform hand hygiene. I would identify the patient. I would ask him, can I please have his full name, date of birth. I would then complete the necessary assessments. So in this case, I think for lisinopril, we would have to check the BP, making sure the BP is within normal ranges. And for guaifenesin, we would oscillate the heart sounds, making sure everything is within normal. And also I would ask the patient if they're allergic to any medications. And then I would explain to the patient what I'm going to be doing. So I'm going to tell him that we're going to be giving his scheduled doses. We're going to be doing it through the feeding tube. If there is any concerns, that he can ask me now. I would then help the patient into a high Fowler's position. And if there is any indication that shouldn't be done, then I'd go ahead and not do it and leave the patient where they're supposed to. So then we were instructed to get five medication cups. So 2 of the medication cups were used with the 2 medications, and 3 will be used with water. So one has 10 ml, one has 30 ml, and one has 30 to 60 ml. So once I am sure to have the 5 cups, I would then place the syringe without the plunger on the NG tube. I would pour 30 ml of water, and then pour the lisinopril, which is the first medication, and then pour 10 ml of water, and then pour the second medication, which is guaifenesin, and then pour, since it's the last medication, I would pour 30 to 60 ml of water in it. Once I have finished the medication, I would clamp the tube and remove the syringe, replace the tube feeding. If there was any more medication going to be administered, like if there was more than 2 medications, I would continue to pour 2 ml of water after every medication is given. And then at the very end, I would give 30 to 60 ml after the last medication. I would then document the administration of medication as soon as possible, and I would evaluate the patient's response once I have done that. I would begin. So now I think the last one is removing the NG tube. So I would begin by checking the medical records for that there is an actual order that the NG tube has to be removed. So once I have done that, I would perform hand hygiene and put on PPE. I would identify the patient with full name and date of birth, and then I would explain the procedure to the patient. So, hello, Mr. P. As per physician's orders, we will be removing your NG tube. I would then again ensure privacy and close the door, close the curtain, and raise the bed to a comfortable working height for me, and then assist the patient to a 30 to 45 degree angle positioning. I would then place the disposable pad across the patient's chest. So I'm going to put it on the patient's chest and give them a tissue if possible, and an Emerson basin in case they need it. If for any reason the tubing was connected to a suction, I would remove it from the suction machine, and I would then unpin from the patient's gown and carefully remove the adhesive tape from the patient's nose, making sure not to hurt the patient. If it is too taped, use an alcohol pad. And then I would pinch the tube with my fingers, doubling on my hand, and then instruct the patient to take a deep breath in and hold it. And then quickly, while the patient's holding their breath, quickly and carefully remove it. I would then wrap it in the disposable tubing and dispose of it as appropriate as possible. I would then offer the patient mouth care, facial tissues if they need to blow their nose, And then I would lower the bed to a comfortable position for the patient, and I would remove equipment and raise the side rails, lower the bed, and measure the amount that was in the emission basin and record it as an output if needed. So I think in this case it would have been 50 mLs. And then the last thing I would do would just remove PPE, perform hand hygiene, and document everything. Thank you.